This is week 2, fetal circulation. The embryonic lungs and digestive tract are non-functional in a developing fetus. The respiratory functions and nutrition are provided by the placenta of the mother. And the placenta is made from cells of both the baby, the fetus, and the mother. And structures are needed to bypass these two systems. And the structures that are required are 2 umbilical arteries, 1 umbilical vein, a placenta, a ductus arteriosus, a ductus venosus, and a foramen ovale. In looking at the placenta blood supply, the blood flows to the placenta through a pair of umbilical arteries that arise from the internal iliac arteries, and then it enters into the umbilical cord. When the blood returns from the placenta to the fetus, it enters in a single umbilical vein that drains into the ductus venosus. The ductus venosus empties into the inferior vena cava, thereby not going to the digestive system. It's a detour. When placental connection is lost after birth, the ductus venosus contracts, and remnants of the ductus venosus as well as the umbilical vein persists through life as fibrous cords. Before birth, the fetal lungs are collapsed and the oxygen is provided by placental circulation. The foramen ovale and the ductus arteriosus function to bypass the lungs. The foramen ovale is an opening between the right and left atria. It's covered by a valve-like flap. It directs the blood from the right to the left atrium. The ductus arteriosus is a short vessel. It connects the pulmonary and aortic trunks so that if the blood enters into the pulmonary trunk, it can be shunted over to the aorta so that it does not go to the lungs. When a newborn breathes air, the lungs expand. The pulmonary vessels expand. There's a reduced resistance. It allows the blood to flow. And the rising oxygen causes the ductus arteriosus to constrict. And the rising left atrial pressure closes functionally the foramen ovale, which does not structurally completely close until the baby's about a year. The pulmonary circulation then provides the oxygen. This is showing you the blood flow to and from the placenta in a full-term fetus. You can see the foramen ovale, the ductus arteriosus, which are both open, the pulmonary trunk, the inferior vena cava, the ductus venosus in the liver, the 2 umbilical arteries, the 1 umbilical vein, and the placenta. In contrast, you have the blood flow through the neonatal or newborn heart after delivery, where you can see the ductus arteriosus is closed, as well as the foramen ovale, and you can see the pulmonary trunk, as it is going to be bringing the blood from the right ventricle up to the lungs. This is a normal heart structure. Most congenital heart problems result from abnormal formation of the heart or problems with the connections between the heart and the great vessels.
I want to talk a little bit about some congenital heart defects. I'm not going to talk about tetralogy of Fallot or transposition of the great vessels because those are part of the group project for 2 groups. However, I will mention that a few of them. And the first one I want to talk about is a patent foramen ovale. In this case, the foramen ovale does not close, and there are variations in this disorder. But when the foramen ovale does not close, the blood recirculates through the pulmonary circuit instead of entering the left ventricle. So instead of going from the left atrium down to the left ventricle and then out the aorta to the body, what is happening is that there is a left to right shunt. and the blood is going from the left atrium into the right atrium, down into the right ventricle, back out the pulmonary trunk, and to the lungs again. It's wasteful, and you're taking blood that's already been oxygenated back to the lungs again. And at the same time, what is happening is that the cells in your body are not getting the oxygen they need. So the arterial oxygen content is normal, but the left ventricle must work much harder than usual to provide adequate blood flow through the systemic circuit. In the case of a patent ductus arteriosus, a PDA, what happens is that the ductus arteriosus does not contract after the baby takes its first breath, and so there still is a connection between the aorta and the pulmonary artery. So then what's happening here is that, again, we have wasteful recirculation. Instead of all the blood going out of the left ventricle and out to the rest of the body, some of it may come back into, by way of the ductus arteriosus, back to the pulmonary trunk. So that is oxygenated blood. However, the other thing that can also happen is that some of the blood which is deoxygenated can go from the pulmonary artery back over to the aorta and it will not have been oxygenated. So the circulating blood is therefore not adequately oxygenated. If you look at the whole picture, it develops a deep red color. The skin develops blue tones, typical of cyanosis, and the infant is known as a blue baby. They will need to go in and cut this connection so that the baby won't have this happening for very long, because this can cause problems in the future for the heart.
In the case of an atrioventricular septal defect, both the atria and ventricles are incompletely separated. The results are quite variable depending on the extent of the defect and effects on the atrioventricular valves. This type of defect most commonly affects infants with Down syndrome. This is a link to a video on fetal circulation.